every 3 hours, an average of 1 rape against a woman or child is reported in Pakistan. 1 woman died every 20 minutes in Pakistan due to health-related factors. 4% of the female population dies before reaching adulthood, often due to a failure to provide timely medical intervention. Maternal and infant mortality remains the highest in the region and amongst the highest in the developing world.
I think a lot of gynecological problems do arise out of sexual dysfunction.
The sexual health problem is existing in Pakistan. These sexual health and the sexuality problem is not only related to the health, but it is related to the development, well-being and the relationship.
Tradition is often used as the motive to inflict violence or carry out crimes against women. Tradition is often confused with religion.
सोसाइटी में जो टैबूज हैं वो बहुत कुछ असरअंदाज हो रहे हैं और बदकिस्मती से उनको मज़हब से जोड़ दिया जाता है, जबकि मज़हब की इतनी बात नहीं है जितने हमारे अपनी सोसाइटी की पैदा करदा चीज़ें हैं। मिसाल के तौर पर कोई घर में बच्चा सेक्स के किसी मौजू पर जो उसके जिस्म में फितरी तौर पर तब्दीलियाँ आ रही हैं, उसकी उम्र के बढ़ने के साथ अपने वालिदैन से या बड़े बहन भाइयों से डिस्कस नहीं कर सकता। अगर वो डिस्कस करता है इस तरह से तो उसको डांट दिया जाता है या ये समझते हैं कि ये कोई गलत बात कहीं से सुनकर आया या गलत बात उसने सीख ली।
मेरी बेटी है, उसको अगर फर्स्ट मतलब मेनोपॉज हुआ था तो बिल्कुल आइसोलेशन में उसको मेरी वाइफ ने कर दिया। इवन मेरे से भी बातचीत न कर रही थी और उस दिन स्कूल भी नहीं भेजा, कहीं एक्टिविटी में ऐसा नहीं लिया। जब मैंने बड़ा फोर्स किया कि भाई क्यों नहीं चल रही आज, तो बोला इसको ये प्रॉब्लम, तो बोला सो व्हाट, इसमें कोई ऐसा प्रॉब्लम नहीं है। और पता नहीं क्यों ख़ास तौर पे हमारे इस माशरे में जो है वो उसको बड़ा वो समझा जाता है कि जी नहीं, बिल्कुल आइसोलेट कर दिया जाए। दिस इज़ रॉन्ग आई थिंक। कहीं भी हमारे मज़हब जो है वो उसको ये नहीं कहता कि इसको आइसोलेट कर दो, आप एक्टिविटीज़ में हिस्सा लेते रहें, लेकिन अवेयरनेस न होने की वजह से कि इवन मेरी वाइफ मेरे को बताने में गुरेज कर रही है।
Doctors are totally unaware about the legal issues. At least they must know the law of the land, and they should also be aware about the religious matters, that what religion says about it. You see, they don't have an in-depth view of the religion. So the in-depth view of the religion as far as the matters of abortions, the matters of divorce, whether divorce can take place in a woman who is pregnant or not, whether how should they help a woman who comes to you with an out of wedlock pregnancy. We do not have any insight of it.
Around 70% of patients want nurses or any health professional to initiate the topic, and 90% of health professionals never initiate the topic. So there is an importance that a person who is ill, there always a health related issue plus sexual health related issue in back of his or her mind. For example, if I take an adolescent undergo any appendectomy, he will be concerned there is a scar on my lower abdomen. Would it affect my puberty? Would it affect in my long-term life? Or there would be many questions. If a married couple is there and any surgery has been done on one of the person, they might be concerned about their sexual health in future. But from health professionals, very rarely it happens. I have rarely seen that. Somebody who has initiated the topic.
Women will come with different types of vaginal discharge and they will beat about the bush and they will say, what do you think is the cause of it? Now, if I were to turn around and say to them that it's possible that you got this from your sexual partner, which is your husband, I'm going to open a box of Pandora, because there's going to be fighting in the house, there's going to be accusations, counter-accusations, and you know, I've got to be very careful about harming a patient instead of helping her. So what I would need to do really is to try and investigate the vaginal discharge to the best of our ability, and most of the time it's not possible to exclude sexually transmitted diseases. Things like chlamydia, etc. are not easy to diagnose, and then you have sophisticated tests like the PCR, which are so costly, going into a couple of thousand rupees. How many people can afford to do them? So most of the time you would be treating them on what you see, and what you would call syndromic treatment.
80% of our population approach GPs, and on the one side we are promoting these family planning methods and contraceptions, and on the other hand, when our clients they approach the doctors, they are quite disappointed because they don't have knowledge, they don't have supply, even they cannot handle the simple side effects. So they become more confused where to go.
Many health practitioners actually reported that whenever they could tell that that client was talking about a sexual health issue or had a sexual health problem, they immediately diverted the topic to something else and referred that client to someone else.
According to research conducted by Aahung, major complaints clients had against the formal healthcare system were that healthcare providers were often critical and judgmental in their manner. Healthcare providers were found to be insensitive to the privacy of their client and the confidentiality of the consultation. Healthcare providers were not considered forthcoming with information or advice. Healthcare providers did not give adequate time or attention to their clients.
मैं ये समझता हूँ कि हमारे डॉक्टर्स इतना स्टेप नहीं लेते फॉरवर्ड कि भाई चलो डिस्कस किया जाए, इनको अवेयरनेस दी जाए. बहुत कम. एक तो पहली बात तो है कि हमारे यहाँ जो है वो मेरे ख्याल में डॉक्टर्स के शायद पास इतना टाइम भी नहीं होता कि वो पेशेंट के साथ खुल के डिस्कस करें, क्योंकि लंबी लंबी लाइनें होती हैं. इवन जब मैं मेरी वाइफ के साथ जो ड्यूरिंग प्रेगनेंसी जाता था तो वो इतना डिटेल में उनसे बात नहीं करते थे जो उनको प्रीनेटल या जो उनको एजुकेट किया जाना चाहिए. तो थोड़ी बहुत वहाँ पे भी है कि इनको जो है वो फुली अवेयर करना चाहिए, पेशेंट को बताना चाहिए आपको ये प्रॉब्लम्स हो सकते हैं. और फिर कुछ प्रॉब्लम्स तो ऐसे है कि इनको हस्बैंड के साथ भी शेयर करने चाहिए कि भाई उनको भी बताने चाहिए कि आप उनको किस हद तक कोऑपरेशन कहाँ कर सकते हैं.
किसी का अगर प्रॉब्लम होता भी था तो इतना नोटिस नहीं देते थे, ठीक है, और ये कि सोचते थे कि भाई छोड़ो ये तो ऐसे ही. हमें सिर्फ प्रेगनेंसी, चूँकि हम माने सबसे ज़्यादा हॉस्पिटल के उसमें हम प्रेगनेंसी तक की और उससे रिलेटेड जो हमें सेक्सुअल हेल्थ की इतनी डीप जो है नॉलेज या इंफॉर्मेशन नहीं थी.
Talking about very intimate topic like sexual health is very rare, and it's kind of out of question thing that some nurse goes to male patient and talks about sexual health history very comfortably. Why? Because they have lack of knowledge, they have lack of vocabulary, that if they talk about some health issues, what vocabulary they should use by using Pakistani Urdu language, because they have all learned it in English language, so they can't translate it to patients who don't know English. So vocabulary was one of the problems, and their cultural background and the gender issues. Female could not talk to males and male could not talk to female.
Even senior people who've been in practice for several years are terribly inhibited. And I don't think that's entirely due to the lack of knowledge, but it's the inability to communicate with the patient in a comfortable way on this subject.
As such, many sufferers of sexual health ailments and complications prefer to visit alternate sources of healthcare.
People have this thing in mind that the formal sector has nothing to offer for the sex-related problems. This is, misconception among the, general public, because they say perhaps, hakims, homeopaths, sex clinics, they can really solve the problems which are related to the sex. So for that, we need to educate public also.
हमारे पास हॉस्पिटल में स्पेशली डायबिटीज़ के पेशेंट्स आते हैं, वो इम्पोटेंसी का शिकार होते हैं. ऐसे भी केसेस हैं जो कि कहते हैं प्रीमेच्योर इजैकुलेशन का मसला है, और फिर इसके अलावा पावर ऑफ इरेक्शन के प्रॉब्लम्स होते हैं. उनके जहन में ये है आम पब्लिक के कि इन प्रॉब्लम्स का होम्योपैथिक डॉक्टर्स और हकीम्स के पास बहुत अच्छा इलाज है. माजरत के साथ कि हमारे एलोपैथिक डॉक्टर्स जो हैं, हमारे दोस्त हैं, उनके पास टाइम नहीं होता है इतना.